Why do some patients need dental cleanings more often than every 6 months? My name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk teeth. I have patients ask me things like this all the time. My sister-in-law comes to get cleanings every 4 months. Should I be getting cleanings every 4 months too? What you need to know is the frequency of how often you should get cleanings is determined by the health of your gums and the level of buildup that you get. So, a patient with healthy, firm, pink, stippled gum tissue and minimal buildup is like plaque or tartar sometimes. It's a no-brainer that would be an every 6-month cleaning patient. Minimal buildup and healthy gum tissue. Having said that, someone who does get plaque and even slight tartar buildup may still be fine on a 6-month cleaning schedule as well, if the buildup is only supragingival, meaning above the gum line. So, of course, there's always exceptions, but that is the main thing that separates you out from the 6-month recare category. If you have pockets that allow buildup to enter below the gums, you're most likely not eligible for 6-month recares anymore. Can you graduate back into a 6-month recare if you change things at home? You know, like maximize your home care efforts? Sometimes yes, and sometimes no. Let me explain further. Patients who need to schedule a 3-month recare are patients that have had either an SRP or a deep cleaning in the past year, and or patients that have areas of gum disease, including perio-pocketing, which means your gums are not at their best health, and or with heavy buildup. Again, buildup is plaque or tartar. These patients generally require either a 3-month recare or a 4-month recare. The frequency, whether it's 3 months or 4 months, is determined on a case-by-case situation after a comprehensive assessment is performed, including an exam with both X-rays and perio charting. With X-rays, the dental provider can evaluate the level of the bone, as well as see if there's any tartar below the gum line that needs attention. With perio charting, the dental provider can find out the health of your gums based upon the probing measurements and overall appearance of the gum tissue. Both X-rays and perio charting are routinely taken to routinely check for improvements. So, if you've been on a 3-month recare, is there a possibility you can graduate to 4 months? Yes. With the proper home care techniques and maintaining your dental cleanings, it is possible. However, there are some patients that will need to continue those 3-month recares, possibly forever. Some patients just have so much bone loss that those 2 extra cleanings each year are needed to maintain their gums. I have a bunch of videos about gum disease, which I will link below if you want more details. But the general idea is that with gum disease, there can be bone loss, which can mean there's more surface area of your tooth exposed, which means it is very hard, sometimes impossible, to properly clean yourself at home. There are lots of supplemental products and home care tools that one can use at home, such as interdental brushes and water flossers, but still, just like patients with healthy gums need to come in every 6 months for the stuff they may have missed cleaning off at home, patients with gum disease have more surface area, thus more areas that are likely to be missed, so they need to come in for cleanings more frequently, every 3 months or every 4 months. The idea behind perio maintenance is just like it sounds. We are maintaining the gums by slowing the progression of periodontal disease. So we can't make it better with this, but we can maintain what you have so it doesn't get worse. Sometimes this is the patient's best option, and the progression of periodontal disease can be slowed down very well. But sometimes a patient's periodontal disease is too aggressive and we cannot slow down the progression. In this case, sometimes gum surgery is recommended with a specialist. If this is the case, the gum specialist you would be referred to is called a periodontist. In conclusion, if you remember one thing from this video, just remember that at minimum, everyone needs dental cleanings every 6 months. But if you have any gum issues, you may have to get dental cleanings more often. Routinely, at your normal exams, whether you're a 6-month recare, 4-month recare, or 3-month recare, what happens at the exams is your dentist and dental hygienist will look at your X-rays and your probing measurements and confirm that you are set and being scheduled on the proper recare frequency. So during your exams, they will tell you if they feel you would benefit or if you need to come in more frequently. That's something that they will check and will communicate with you at your exam. I hope this video helped you. Please like and subscribe if it did. If you want to learn more about gingivitis and gum disease, I've linked those videos below, and you can also learn more on my website, teethtalkgirl.com. My website contains articles and videos with a search bar, so you can search for a specific dental topic.